WHO has been working with indoor air quality issues and indoor air pollution for many years. We have a global database on air pollution and health, on household energy fuels, and we have been sort of active on that in terms of more the air quality guidelines, which are general standards for air quality and health. But more recently, we realized that to make a contribution to the household pollution problem, which causes over 4 million deaths a year, we realized that we really have to come much firmer with recommendations with clarity about what's clean air inside the home, which technologies deliver clean air, and how clean these technologies have to be. In the past, there's been this understanding or this misconception that any improved cook stove would deliver health benefits. We now know, because of scientific studies, that that's not the case. So we felt that with this new knowledge, we have to come up with the synthesis of that knowledge and make clear recommendations about how clean a technology has to be, a home energy technology has to be, how clean a cook stoves, fuel for or technologies for lighting or for heating, how clean they have to be to protect public health. And that's what the new guidelines produce. They give specifically emission rates, how many grams of a pollutant per minute can be produced, so we can achieve clean air and have health benefits. But also there are specific recommendations against the use of kerosene. Kerosene is a very polluting fuel, which produces a lot of health disbenefits. Even if it is a liquid fuel, in the past it was all about solid fuels being bad. Kerosene is a liquid fuel and is very bad, so people shouldn't be using kerosene. And the other recommendation is that people should not be using coal in the home for heating or for cooking. So those two things are prescribed. Say we shouldn't be using them, and whatever technologies are used for cooking, lighting, or heating, they should comply with certain emission rates. So we provide the basis for countries to develop standards, for example. I think there are many successful stories about how to address air pollution. Basically, you need some bold measures. The air pollution is a very pervasive problem. It doesn't happen just with a tweak here and there. So if you want, London was a very polluted city. You couldn't see a few meters across in the 1950s, until the 1950s or 60s. And they, from one day to the next, after realizing that the air pollution was leading to a lot of extra deaths, they forbid the use of coal in the homes. So with a law, they forbid the use, and London became clean. And that led to improvements in health. It was very mathematical. So it's not, the difficulty is getting one, to that bold decision, to having the technological solutions to provide the substitute for the polluting fuel or the polluting technology. I think India has enormous capacity to plan and to make the decisions on, but I think one example that I could give of a country nearby who's taken a bold decision is Indonesia, which very recently they shift subsidies for diesel to subsidies to liquid gas. In doing that, they provided clean fuel for, I think, initially 30 million people, but they're aiming at 70 million. And they also saved in the subsidies, because the subsidies for liquid gas cost less to the Indonesian government than subsidies to diesel. Diesel is a very damaging pollutant, whilst liquid gas is a clean pollutant. Now, I don't know the specific circumstances, but usually when you have already some kind of subsidies going on, I think you can look at it with a fresh eyes to see where is it that those resources could be better deployed. That's one example, just taking from Indonesia. But the other part of the story is to start really the development, and India has a very good story on that, a very good track record of developing cleaner technologies, of testing those technologies and deploying them in the field. So I think as India also uses the results of these new guidelines which just came out. They can sort of bring that into the context of the technological development and implementation experience that they already have to, to see how they can best make use of that. There's a very interesting development in this part of the world. It's not only India, it's the Southeast Asia countries, the 11 countries of Sierra. They have decided to reduce, in their strategy, to reduce non-communicable disease, that is heart disease, strokes, cancers. They decided they would also take measures to reduce indoor air pollution. So that's something which is very unique to this region. I think is very innovative. Other parts of the world still have not gone that way. I think this is the area, the region which is leading in making a link between the non-communicable disease agenda and indoor air pollution. So same thing, they could also move into the pneumonia prevention. Normally people use vaccines, use antibiotics or for early treatment, but using or investing in clean household energy as a strategy to reduce those diseases is probably something that would pay off. And I'd say that this region is far ahead in that strategy. I think there's some potential synergies and there's some virtuous circles. I mean, what you want, hopefully, is to use the resources which are being deployed for climate change, like the climate fund, or that are aimed to reduce climate change in ways that can also benefit people, especially poor people. And I think household energy and improved household energy technology in fuels is one of those examples, where you could take climate fund investments or CDM, clean development mechanisms, or other funds where the goal is to improve climate, but use it in ways that improves climate, but also improves people's health, especially poor people's health. So I think doing that connection is a virtuous way of using the synergies that do exist between climate and household energy to protect people's health and to help those who are suffering more from the negative impacts of household energy. Well, I think basically there is a lot of leapfrogging that can happen. I mean, people in urban areas in India are already moving into induction stoves, for example, which are very efficient. It's just a matter of having access to electricity. I think that the whole picture of access to energy should be shifting in a major way not in 50 years, but much shorter than that, hopefully. And I think there's, for example, the Sustainable Energy for All initiative of the Secretary General should have a role in that, because they're trying to support shifts into more access to clean energy, and that should play a role, especially if it becomes a sustainable development goal. And if we have access to clean energy in the home as an indicator of achieving that goal, I think and we're halfway there. The decisions have to be made in September, but I think there's good chances that we're going to have that. So if that happens, then we'll have more investments coming to clean energy in the home and providing access to clean energy, especially to the poor. And we may see a very quick shift in the direction of improvement, both in terms of access to energy, but also in the reduction in the negative health impacts from air pollution, but also the burns from kerosene, the intoxications that happen for some of the fuels. It's not only the air pollution, the negative health impacts. It's also the time that women spend around the cookstoves, or girls not being able to go to school because they have to be helping around, because of the use of inefficient cooking and heating and lighting technologies. So it's a range of development impacts that can be achieved by those, potentially by those improved technologies and strategies.